A new report raises questions about the way Robert F. Kennedy Jr. is conducting business at the Health and Human Services Secretary. Internal documents meant to defend the administration's vaccine policy cite unpublished or even disputed studies. This is according to the Kaiser Family Foundation. One expert calls it, quote, willful medical disinformation.
Dr. Payal Kohli, our 9 News medical expert, joins us now to break down this report further. So what have been some of the concerns that have been raised about the science?
Well, as Alex just said, they're saying the sources of science, the references cited in the documents aren't high quality studies. They're saying some of the claims actually made by the documents are blatantly false or misinformation. The fact that they haven't published the documents in an open forum on their website, that's a little bit concerning. And they haven't revealed who the author of the studies is either. So all of this raises questions as to the integrity of the actual document.
I think you would have to have all of those things in place to even quote something like that, but obviously not. What are they saying? Can you talk about any of the specifics?
Yeah, so they're saying that some of the studies are preprint studies. So these are studies, for example, you, me, Sam, any of us could actually put something online without it being peer reviewed. Peer review is considered one of the highest levels of sort of scrutiny of some kind of a scientific study to make sure that other doctors and experts think that it's good. So that's one problem. They're citing some documents that actually have the wrong information, saying, for example, that pregnant women can get placental blood clots as a result of the COVID vaccine, something that's not really been supported. It's actually been refuted. They also have questionable scientific methodology. So they're comparing the wrong things to the wrong things. So they're saying if you get the vaccine, you have a higher risk of heart inflammation or myocarditis, which is true. But what they're leaving out is that COVID itself gives you an even higher risk of that myocarditis. And so it's almost giving it sort of the wrong conclusion. And some of them actually have the wrong references. So you have the wrong reference attached to the wrong citation. So all of this put together makes for a really questionable scientific advisory document.
And just as a patient, right, you want to be able to have all the facts presented to you so you can make an informed decision, right? That should be our constitutional right. How does Congress usually get scientific advice? Do they verify the references independently, or do they look at the quality of the advice?
So they have the option to verify these references independently. Now, most people in Congress don't have the time nor the bandwidth to sit and verify them, nor are they qualified, to be entirely honest, because they're not scientists or physicians, to know the integrity of the scientific methodology. So even though they have that privilege, they don't often exercise it. So they really rely upon HHS advisory committees such as this one, the CDC, the NIH. Sometimes they'll call in experts to do testimony and such when there's a question in place. But this is a document that they're actually going to be relying on to make a lot of public policy decisions. So therefore, we have to be sure that what we're feeding them or giving them is of the highest integrity.
I mean, this is really scary if we're talking about policy that's going to affect entire country. What happens now?
So I'm worried that garbage in is garbage out. If they're working off of information that is not accurate, not correct, they're not equipped to make the correct decisions. They're not equipped to actually make actions based off of scientific evidence. And I do worry that this is going to lead to further worsening of the vaccine hesitancy that we have already seen so much of. So come this fall, we've already seen some people have limited access to the COVID vaccines. We do have a new variant as well. Thankfully, it's not more virulent, but it's a summer variant, which is, again, highly unusual. So put all that together in a few months, what exactly are we looking at? And that combined with the fact that the entire vaccine advisory committee has just been overturned gives me as a physician a lot of concern. So certainly it's a good idea to bring in fresh voices and fresh faces and fresh perspectives. But when you're talking about wiping out an entire committee, you're talking about a tremendous amount of turnover that can actually lead to more harm than good.
Dr. Kohli, I feel like we could have this discussion longer, but thank you so much for breaking that down and for also expressing your concerns. Thank you.